Hey mama, during pregnancy and labor, there are a few procedures that are considered routine, one of them being vaginal or cervical exams. It's important to know what this exam is, what it might tell you, and that you 100% have a say in whether you want it performed, and we're talking all about them in this video. You have a say in everything that happens before, during, and after your birth, and knowing how to advocate for yourself in the small things helps you feel confident advocating for yourself in the big things. I'm Bridget and I'm a childbirth educator and birth doula, and I love helping mamas believe in the truth that they are built to birth. If you're new here, make sure you subscribe and hit the bell so you don't miss any informational and empowering future videos. So what are vaginal or cervical exams? First of all, let me clarify that both of these terms in pregnancy are used pretty interchangeably. So if I say vaginal exam at one point and cervical exam at another point, I'm talking about the same thing. So a vaginal exam is done by an OBGYN, a midwife, or a nurse by putting up 2 fingers into the vagina to feel for the cervix. A lot of women think the vagina is their whole outside parts, but the vagina is actually the tunnel that leads from the cervix, which is at the bottom of the uterus, to the outside of the body, and the other outside parts are called the vulva. So when an OB, midwife, or nurse is performing a vaginal exam, they are searching for the cervix, which is at the top of the vagina. The cervix is kind of like the gate into the uterus. So all throughout pregnancy, the cervix is hard, it's thick and closed until mama nears the time that baby is ready to be born, and that gate starts to soften, thin, and open to allow baby to pass through it. During labor, that gate continues to soften, thin, and open till baby is able to fit completely through it. Oftentimes, cervical exams are going to be given towards the end of pregnancy to see if mama's body is starting to make progress. And by progress, we are talking about that gate, the cervix. Is it thinning? Is it softening? Is it opening? Sometimes women will be at the end of their pregnancy around 37 to 40 weeks and already be 2 to 3 centimeters dilated. Usually that's for a mama who has given birth before, but sometimes that can happen for first-time mamas too. But for a lot of first-time mamas, they're going to thin out and soften before their cervix will begin opening. Cervical exams will also let mama know where her baby is in the pelvis. In order for baby to be born, they have to move through the pelvis, and depending on where they are in the pelvis, they will be at different stations. The station of the pelvis goes from -3, where they are floating above the pelvis, to 0, where they are engaged and smack dab in the middle of the pelvis, and then +3, where they are crowning and ready to be born. And so with a vaginal exam, a care provider could tell you where your baby is in the pelvis and is a good indicator of the progress you're making towards the birth of your baby. So vaginal exams can tell you a lot about yourself and your baby, but what it can't tell you is when you will have your baby. A lot of women are disappointed by or nervous from the results of their vaginal exams toward the end of their pregnancy or even during labor because they aren't what they expected them to be. Towards the end of pregnancy, a mama can go into labor being completely closed or just 1 centimeter dilated, while another mama could be walking around for weeks being 3 centimeters dilated before going into labor. I've worked with and heard so many stories from mamas who had very thin, also known as effaced cervixes, and at 3 to 4 centimeters dilated, who took 2 to 3 weeks to go into labor. Then I've had mamas, myself included, who went into labor only being 1 centimeter dilated and had their babies 9 hours later. So try not to be discouraged by what your exam says, because labor is unpredictable, and the best thing that you can do towards the end of pregnancy to help labor begin is to relax, be in an environment that you feel comfortable and safe in, and feed your body and baby truth, that it is safe, that you are patient, that it is doing things in the right timing. Mama, where your mind leads, your body follows. And when the mind is tense, the body is tense. And in order for baby to be born, the body must be soft and open. One of my favorite ways to relax the mind and body is through affirmation meditations that guide the mind into deep relaxation by feeding it positivity and truth. I have a whole playlist of affirmation meditations for you that you can listen to on YouTube, which I will link right up here, or you can purchase and download them from my website, builttobirth.com, which I've linked in the description below, so that you can have the affirmation meditations with you wherever you go and whenever you want, and you don't have to be on Wi-Fi to access them. Now, in labor, it can sometimes be really discouraging for women to hear what their results are for their vaginal exams if they aren't making the progress that that they are assuming they're making. Mama, I want to remind you that labor is not defined by dilation, and I talk all about the ways that you progress through labor in this video that I'm linking up here. Some women like to have frequent vaginal exams to help them know their progress, while other women don't want frequent exams because they don't want to run the risk of being discouraged and that impacting and hindering the progress of labor. Whether you want vaginal exams or not, it's important to remember that your body is going to do whatever it's going to do, whether you know it's doing it or not. The other very important thing you should know is that the cervix during pregnancy and birth acts as a sphincter muscle, which is the same muscle that the anus is that allows you to poop. Sphincters are shy, which means when they feel embarrassed, exposed, or threatened, they're going to close, which you've probably experienced if anyone has ever walked in on you while you were going number 2. Sometimes if a woman has had a rough vaginal exam or didn't feel like she was expressing consent to one when she received an exam, that sphincter muscle, the cervix, will close or stop opening, and when you're in labor, you want to keep that gate opening more and more until baby is born. I talk all about this and more and how to keep the cervix open through labor by using relaxation and avoiding unnecessary medical interventions, and so much more in my new online childbirth course, Built to Birth, which you can now access through my website that I've linked down below, builttobirth.com, that gives you the building blocks for a happier, healthier, and easier birth. So if you're feeling like you need more information on how to achieve an empowering birth, be sure to check out that course. The last thing that I want to talk about in regards to cervical exams is that they're 100% your choice whether or not you want them done. Mama, remember, this is your body, it's your baby, and it's your birth. So you have the option to give your consent or refusal to whatever procedure is being requested of you. Yes, they will typically give you one towards the end of your pregnancy. They generally want to give you one before you're admitted into the hospital. You likely will be offered one at some point during your labor and then another before you begin pushing. But Mama, you get to say yes or no to them. It is up to you. Make sure that if you hear a provider saying, okay, I'm going to give you a vaginal exam now, okay, that doesn't mean that you have to say okay if it's not something that you want at the time. If it is, of course, say whatever you would like, but if it's not, speak up and let them know what you want or don't want. Most of the time, your care team is doing vaginal exams as a super routine part of their job. It's not really their fault, but at the end of the day, Mama, you will remember this experience for the rest of your life, so you need to be the one calling the shots. Again, this is something that I am a big advocate for, and I talk all about throughout the Built to Birth online course, so if giving informed consent or refusal is an important part of your birth experience, I encourage you to take the Built to Birth course. Now, if you are a mama who doesn't want vaginal exams, you should know a few things. If you don't want a vaginal exam before being admitted into the hospital, you are going to need to be in established labor where your care team can definitely see that you are in active labor. And even then, they still might want to do an exam before admitting you. This is something that you are going to have to discuss and perhaps find a compromise on with your care team. If you are considering whether or not you want an intervention and the progress of your cervix will affect your decision, then a cervical exam might help you get the information that you need to make a true informed decision. So for example, if you are considering an epidural, but you would only get an epidural if you were 6 centimeters, but not if you were 8 centimeters dilated, then getting an exam would probably help you make that decision. Then lastly, if you do have an epidural, a cervical exam is usually necessary to make sure that you are completely dilated and effaced before your medical team would want you to begin pushing. If you are having an unmedicated labor, they still might want you to do an exam, but it's a bit more negotiable because a lot can be learned through your behavior and body language, which can show whether or not you're ready to begin pushing. Now, if you're a mama who wants to be checked frequently, there are a few things that you should know as well. Typically, exams are only done when you show a behavior change or a labor pattern change. So let's say you went from talking between your surges to now not talking at all and having to really focus on your surges. That'd be an indicator that labor has changed and maybe your cervix has as well. Or if you start grunting or pushing during your surges, that's another behavioral change that might indicate a physical change in your labor and cervix. If you're hooked up to a monitor and your surges are becoming more frequent and lasting longer, that's another indicator that something has changed in that labor pattern that might mean that you could ask for another cervical exam. Now, if your water has been released and your baby no longer has that protective layer of their amniotic sac and fluid around them, vaginal exams will be given very sparingly, because the more vaginal exams done, the increased likelihood there is for infection, which mama wants to avoid as much as possible, because each time fingers reach up in there, it's an elevator ride up for germs and bacteria. And the last thing for mamas who want those frequent checks, remember, your body is going to do what it's going to do with you knowing about it or not. Sometimes when mamas are so focused on needing to soften, dilate, and thin, they're actually holding on to that tension instead of letting go, trusting the process, their body and their baby, relaxing and allowing the process to unfold in whatever way it needs to. So instead of putting all your energy into finding out what your next cervical exam will be, try to focus on things that you can be proactive in doing in your labor, as far as movement and relaxation techniques that will help you dilate, soften, efface, all of those good things for your cervix without putting so much energy into that next cervical exam. Mama, this is your birth, and so being informed, knowing what procedures are doing what, and knowing your rights is so empowering. Whether you are an all or nothing kind of mama when it comes to vaginal exams, now you know what they are and what they can tell you, and so that you can make whatever decision best suits your birth experience best. You are the author of your own birth experience, mama, and I hope that you feel empowered by that reality. So thanks for being with me in this video, and I will see you in the next one. Bye, mamas.